Hi, everyone. I'm Michelle Jobin, and you are listening to Time to Talk, a podcast for caregivers. This podcast is dedicated to helping family caregivers in Ontario. Through expert tips and resources, you will gain knowledge and validation for the ups and downs that come with caregiving. More importantly, you'll learn that you're not alone. It's so important to take this time for yourself. We're glad you're here. Today, we're joined by Dr. Tara Kiran, a family physician, researcher, and advocate for a stronger, more equitable primary care system in Canada. She is the Fidani Chair in Improvement and Innovation at the University of Toronto and a scientist at the MAP Centre for Urban Health Solutions. In addition, Dr. Kiran practices family medicine at St. Michael's Hospital, Unity Health Toronto. In 2022, Dr. Kiran launched OurCare, a national initiative aimed at reshaping primary care based on the needs and voices of patients. She also hosts Primary Focus, a podcast that takes listeners inside the realities of healthcare transformation. Dr. Kiran, thank you so much for being on Time to Talk today.
Wonderful to be here.
I really am looking forward to this conversation because there are many levels in which primary care affects Ontarians. And I think if we kind of look at how it is specific to caregivers, it's a really important piece of the puzzle in the caregiving journey and also the loved ones that they are caring for. So I think our listeners are really going to find a lot of little nuggets of information that they can really learn from today from you. I wanted to talk first about what I think, if it's okay for me to say, is the primary care crisis in Canada and in Ontario. Many people hear this term primary care, but might not even fully understand exactly what it means. So can you please break down for us what is primary care and why is it so crucial to a well-functioning healthcare system?
Yeah, absolutely. So primary care, I think about as the foundation of a healthcare system. We actually know from studies internationally that health systems that have strong primary care actually have better health outcomes for their whole population, less inequities between different groups of people within that population, and actually spend less. Like they're kind of more cost-effective systems because they've invested upstream in this primary care system. So primary care, is that foundation. Really, it's where you should be going when you have a health concern. So any health concern that is not an emergency should be seen by your primary care team, physician, or nurse practitioner. So what do I mean by that? So let's say you have a new problem, you would go to your family doctor. Let's say you've got a existing chronic condition like asthma or diabetes, you would be going to your primary care team or family doctor to see how you can better manage that to stay well. How about staying healthy? Like, let's say you actually don't have any issues and you just want to stay well. Well, that's also the role of primary care to like help you with vaccinations or cancer screening. Primary care also actually coordinates the care you get from different parts of the healthcare system. So let's say you do have something that's more complicated, or you have multiple chronic conditions and you need to have tests or see specialists. It's the primary care team who would actually be referring you, but then also helping you to manage all of the different things that might be happening. So let's say you have consultations from a number of different specialists. You need to make sense of like all of that information and put it in the context of you as a person. And primary care is the place that does that. So really like the tenet of primary care is it's that first place you go. It's supposed to be really accessible. It's also supposed to provide care over time. So this idea of a strong relationships or relationship continuity is really embedded in it. And it's really supposed to look after the whole person. So not just one body part, not just the physical aspect, but the physical and the mental and social well-being. So it's really comprehensive in that way. And so what I would say, related to primary care is that in Canada, for the most part, primary care is delivered by family doctors. More and more, we're seeing it delivered also by nurse practitioners. And we will talk about this more, but the future of primary care, I think, is really in team delivery, which means family doctors and nurse practitioners working with others. And I will say that absolutely primary care is in a crisis. I think that is very apt.
It is the absolute foundation of our healthcare system. And I thank you for that explanation because it just illustrates how important it is. And we talked about family doctors and how they play into that part of primary care. They
Mhm.
are the crucial part of primary care at this time. With Canada priding itself on universal healthcare, yet 6.5 million people in Canada do not have a family doctor right now, which is that crucial element to primary care. What are the biggest factors driving this crisis in primary care in Canada? And do you see these challenges evolving in the coming years?
Yeah, so let's just start maybe even with this term crisis and how
Mhm.
apt it is, because when you have the front door of the healthcare system that's inaccessible to more than 1 in 5 people, it really is, I think, a crisis. And that number, 6.5 million adults, without primary care, that's an estimate that we came up with based on the results of a survey we did in the fall of 2022. We're actually going to be launching a new survey. Stay tuned in the next couple of weeks. And so if you go to our website, OurCare.ca, you can actually participate in that and help us understand what that crisis is like now. But yeah, there's so many factors that have led us to be where it is that we are now. And, simply put, I kind of think about it as like demand and supply, and both of those factors changing. So, on the demand side, we know that we have a growing and aging population. There are more people to take care of, and each person actually just takes more time. So, each person has more chronic conditions, often more social issues, actually. And all of that takes more time when you're actually seeing them and supporting them in their healthcare journey. On the supply side, we've got a real problem. So we know that Canada actually has fewer doctors per population compared to many of our peer countries. And then, within that, we know that fewer people are actually choosing family medicine as a specialty. Even those who choose to train in family medicine, more and more of them are choosing not to practice in a family practice, but actually use their training in a different way and practicing, for example, in a hospital setting. And we also know that, there are many people who are retiring. And that the COVID pandemic actually accelerated some of that. So some of the work we've done, some of the research has shown that during the first 6 months of the COVID pandemic, for example, about twice as many people stopped work as we would have expected based on trends from the previous decade. And I will also say there's kind of a larger demographic trend and changes as well when it comes to the workforce. And we can see that, everywhere. We know that people in general are more conscious about having work-life balance and don't want to work really long hours in the same way that maybe, their predecessors or previous generations worked, let's say 30 years ago. And so that means, one family doctor will be working fewer hours than one family doctor might have been in 30 years ago, and is able to see as a result less patients. And we need to, that's not a bad thing. We just need to plan for it. And I would say, at the crux of this is we haven't done the healthcare planning that we really need to do. All of these trends, many of them, almost all of them are actually, predictable. We know we can see the aging and growing population. We can see the trends in terms of our workforce, and we need to plan accordingly.
One sort of analogy I always like to use in a situation like this that's from sports is that I don't even know if we're playing where the ball is, but we're not playing where the ball is going at all, are we,
Right.
at this
Yeah,
point?
yeah, that's right. I mean, and we can see actually other countries, some of the challenges we're facing are actually challenges that many countries around the world are facing. So they're not unique to us, this growing aging population,
Mhm.
more medical complexity, people's like changes in the workforce and how people want to work. These are actually global trends in high income countries. Um, but I've seen some of our other peer countries take a much more rational approach to planning, where they're monitoring things like, what proportion of the population is able to access primary care, or, what portion of doctors are accepting new patients. So, those are things that are routinely monitored in some other countries, whereas in Canada, we don't even have a database of all the family doctors practicing in a province, let alone know whether they're accepting new patients.
Ooh, I feel like that's something that we should have. We should get somebody to do that. Absolutely. Okay, that's a nugget of information we will save for another time. But I wanted to talk more about how this relates to caregivers because caregivers are already navigating a complex system and situation. And what does this doctor shortage mean in practical terms for caregivers and their ability to get timely and consistent care for those that they are caring for?
I mean, it really adds a challenge to an already challenging situation. I really feel for, our caregivers out there and many of the listeners who are listening in on this episode, of course, are caregivers. And, they are spending tens of hours every week, hundreds of hours looking after a loved one with often no training or expertise, no additional resources or compensation, sometimes not with, requisite recognition or time off. Um, and so a super challenging situation. And at the same time, what this primary care crisis has led to has meant that our caregivers aren't getting the supports that they need. Our caregivers don't have medical expertise. They did not go to medical school. They need to work alongside in partnership with a physician and primary care team. And unfortunately, when 1 in 5 people don't have a family doctor, it's really a problem. And I think like it's important also to kind of break down that statistic a little bit too, to say that what we found is actually the problem is even worse in some parts of the country. So, if we were thinking about British Columbia, it was actually about 1 in 4, and in Quebec and Atlantic region, it was almost 1 in 3 people without a family doctor or access to primary care. And what we also did see was that there was an age-related kind of effect as well. So people who were younger were less likely to report having a family doctor than people that are older. But actually, what was striking to me is that even those over age 65, there was a significant portion who were still reporting not having a family doctor. And, guaranteed when you're over 65, you really need one. And so I know that our caregivers are looking after a range of patients, different medical and social complexities and ages. But regardless of all of that, not having someone to collaborate with and support you as you are supporting your loved one through the journey is really a failure of our system.
Is there, in addition to those demographic breakdowns that you mentioned, is there also a rural versus urban component as well when we look at sort of how we are covered in terms of primary care availability?
It's really interesting that lack of access to primary care is a problem both in urban and rural areas. And so when we look more deeply at the areas that are underserved, we can see areas that are in rural areas, we can see rural and northern areas, but we can also actually see pockets in densely urban areas as well. So in some ways, it would be actually just more logical to say, oh yeah, it's just a rural northern program problem that we have here in Canada. But actually, it's much more complicated than that when even in a big city where there are, in theory, a lot of doctors around, geographically, we are still having shortages. I will say though that, a specific unique issue is our remote populations and particularly also First Nation reserves, patients living on First Nation reserves. I mean, those are areas where it's very hard to access care, and the way primary care looks is very different. And so there's, any access to anything, but then there's also, okay, if you do have access, let's say, to a nursing station, is that getting you the care that you really need?
We look at caregivers as being advocates for those that they are caring for, and they are doing so in an increasingly strained healthcare system. So, for those caregivers trying to get care for their loved ones in this overloaded system, especially without a family doctor, what do you suggest are the most practical steps they can take to get their care recipient seen and heard?
I will say that's a tough question because, I would want them all to be able to go to their family doctor. But I will say that, we've done our best on our OurCare website actually to put some practical resources there for people. So if you go to ourcare.ca/find a family doctor, but even if you just go to if you go to ourcare.ca and you scroll down to find a family doctor link, and you go to that page, you'll see for every province and territory in Canada some resources for how you can go about finding care. So for most provinces and territories, there is a number you can call and often a related website. Usually it's 811, and you call that number. And often you can be put in touch with a nurse, actually, in most provincial and territorial settings. And that nurse can help you navigate what it is that you need. So sometimes they might be able to address the issue. So, for example, let's say you're trying to support getting someone breast cancer screening or colorectal cancer screening. Those are some things that the nurse would be able to support you with. For example, they could help you to book a mammogram without the referral of a doctor. They would be able to send you a colorectal cancer screening kit without the referral of a doctor. So there are some things that they can help you directly with, and then they can also help you to, navigate and say, okay, well, actually, this issue probably does need to be seen by a doctor. You don't have one, so, this is my suggestion, go to this urgent care or this walk-in clinic. And then usually the same number will also help you to get onto a wait list for a family doctor. Now, whether there is a centralized wait list does depend on your province and territory. For example, in Ontario, we know there was a service that was called Healthcare Connect, and people can get signed up by going to Health 811. But at the same time, we also know that there are issues with that service because, I've experienced this with like several of my patients who move to a region and are told that actually, it's going to take years, if not a decade, for Healthcare Connect to actually find someone to connect them with. Um, so I think, that's probably my best advice is to try Health 811 or dial 811 in your region, and see, what it is that the nurse that you get in touch with says. I think the other thing that many of the Health 811 portals have, so especially, the one in Ontario I know does this, is they also have some really good education, Health 811 in Ontario does this where they have some really good patient education resources on a variety of topics. So I think the other thing in general that you can do as a caregiver is try to educate yourself on common conditions or issues that your loved one might be facing. And I'll just say that, Health 811 is a great resource. There are also other resources. So ideally, you're not just using Google, but you're using a resource that is put together by, a government agency, or a reputable healthcare professional organization.
For many of us that are on any of the sides of the health care equation, so whether it's a physician or perhaps a patient or a caregiver, sometimes, and especially on the patient and caregiver side specifically, sometimes the idea is that, okay, I've gone to see a doctor. Doctor says this. This is the answer I accept, and there's no other answer that's possible. But sometimes we feel that we might need a second opinion. So many people don't actually know or feel that they have that right to ask for a second opinion. So when that gets overlooked or a patient feels that they don't have the right to do so, how can caregivers use their ability to advocate a little bit more impactfully for those that they care for?
Yeah, that's can be a really tricky situation for people. But I think what I would say is that it's important to air your concerns clearly and make the request clearly. Uh, you can do that in a nice way, using a nice tone of voice that is still, expresses
Absolutely.
gratitude and appreciation for the opinion you did receive. And you can explain, why it is that you might want a second opinion. And, I think most doctors who would hear, a respectful, thoughtful request, would go ahead and ask for that second opinion. I do want to say that this all becomes more tricky in the context of a healthcare system that is strained. So, it is really hard often to actually find a specialist to see patients in a timely way for a first consultation.
Hmm.
And so just, understand that you will probably be waiting quite a long time potentially for a second opinion, and that's actually probably appropriate given that many people haven't received their first opinion yet. And of course, that it means, to think carefully about, do you want this second opinion? And if you do, like, go ahead and ask. But just to say that we do have we do have a challenges accessing specialty care in a timely way in this country. And that's a whole other kind of episode, I think, that you could do. But I think, understanding the situation in that context for you is important.
You can make a difference in the caregiver community by becoming a volunteer. The Ontario Caregiver Organization is dedicated to providing caregivers the resources needed to help them be successful in their caregiving journey. Becoming a volunteer means you can help support caregivers in a variety of different ways. You can join a working group, an online forum, a focus group, or provide peer support. Volunteers can make a huge difference in a caregiver's life. Become a volunteer today at ontariocaregiver.ca. Now, back to our episode. So, Dr. Kiran, caregivers are often in a state of just being in survival mode, focusing on the immediate needs of their care recipient. For those who want to push for real change, what are the most impactful ways to get involved in advocating for better healthcare policies?
Such an important question, and also one that I've been reflecting on for a while because, I've been doing research in primary care for over 15 years, and I've been a family doctor for over 20 years. And over that time have been engaged in wanting to improve the healthcare system. And I will say one of the things that is positive right now is that things have gotten so bad that people are listening, and primary care is on the agenda of many governments. And I think what my experience, particularly over the last few years, has taught me is that ultimately, if we want change to happen, we need to convince our political leaders that this change needs to happen. And the only way to do that is through the public making their voices heard. And so that's why through OurCare, first of all, we worked really hard to actually understand public opinion and amplify the voices and experiences and preferences of people across Canada. But if you go to our website, ourcare.ca, what you'll also find is a whole section under the heading Advocate that supports people to actually advocate for a better primary care system. We have on that web page, for example, a presentation that kind of talks about advocacy more broadly. We have some videos you can go to learn more about primary care. We have actually a really nice short 7-minute video that tells you all about the crisis so you can really educate yourself. We've actually got some great 2-pager handouts that you can take with you, for example, if you schedule a meeting with your MP or MPP. And if that feels too intimidating to you, you can always start with just writing a letter to your elected representative. And we actually make that really easy to do on our website. We have a templated form. You just put in your name and your postal code, and then based on your postal code, it'll auto-generate your elected representatives for that area. And we've kind of drafted an email that you can edit, and it tells people kind of about the OurCare standard, but you can add things further in that email. So I would say that it's really important for you to get involved politically. That can be anything from sending a letter to meeting with your MP or MPP to joining kind of more grassroots groups in your community that are advocating for change. I would say the other thing that you can do is look for opportunities to be a patient or caregiver partner in local healthcare organizations. So many hospitals or Ontario Health teams or primary care teams are actually often looking for patient or caregivers to help them um, design what im- they're looking for partners to help them improve the services they're delivering and ensure that they're meeting community and patient needs. So look to see if those opportunities are available, if it's something that you think you might have time for. And then I guess the last thing that I would say is, we'll talk more about OurCare, but if you and we have a little bit, but when you go to the OurCare website, you'll also see that we're going to be launching a new survey, and we are looking for people across the country to fill out this survey to tell us about their experiences of care. And we will be using that as an advocacy tool to support change in the system that aligns with what it is that people told us they want to see.
Well, I did. This is a great lead into my next question about our care, and you've given us so much context when it comes to our care in terms of the resources that are available. But can you tell us a little bit more about the platform and what was the impetus behind you founding it?
Yeah, so, as I mentioned, I've been involved in healthcare research for a really long time. And I've been involved actually in discussions about system reform for a long time as well. And I noticed, when I was around these tables talking about healthcare reform, how we should do things differently, often there was like a critical voice missing. And that was the voice of patients in the public, the very people whose voices and views the system actually should be designed around. And so that was really the impetus behind OurCare, was to understand not just the experiences of patients in the public, but to understand what was important to them in terms of a future system and to help co-develop, co-create a blueprint for the future of primary care together with the people who the system is really should be serving. And so that's why we launched OurCare back in 2022. It was a 16-month long initiative where we heard from nearly 10,000 people across the country who collectively spent about 10,000 hours with us. We had three phases to OurCare. The first one was this very large national survey where we heard from more than 9,000 people. But then I think the real magic in OurCare were actually the dialogues that we convened. So, in each of five provinces, including in Ontario, we had citizen reference panels made up of about 35 randomly selected people across the province who roughly represented the demographics of that province. And together they spent about 30 to 40 hours learning about the primary care system, but then also making recommendations. And they wrote their own report saying, what it is that they wanted to see, which is you can find all the reports on our website. And we worked hard to actually get really senior decision makers to kind of come to the end of their time together so that the OurCare panelists and our public volunteers could actually present their results directly to senior decision makers. And then our third phase was actually these 10 community roundtables because we knew that, our first two phases probably left out some important voices. And we also know that primary care access is a lot harder for some communities, including people who are Indigenous, people who are Black, people who are newcomers. And so those were some of the foci for our community roundtables that we did in partnership with community organizations to really understand the unique needs and amplify, the priorities of those groups. And so all told, we put everything we heard through, our many consultations and summarized, our the findings from our 16 reports into a final report that we put out in February of 2024. And that final report actually laid out something that we call the OurCare standard, which is six simple statements that describe what every person in Canada should be able to expect from the primary care system. And that's really the foundation of all of our advocacy and our work now moving forward. Let's get that standard implemented and adopted by governments across the country.
In all of these phases of our care and all of the discussions that you've had, all the research that has been done by our care, what would you say was the most eye-opening or expected takeaway from that?
Hmm, a great question and a hard one for me to answer, but I think what I would say is that what was so wonderful to see was actually how much consensus there was. I mean, we live in a time of what seems like intense polarization, right? You turn on
Mhm.
the news, you read the newspaper, you go into social media, and it seems like there are a lot of people who really disagree with each other. But when we convened these conversations, I mean, we had real diversity in the people who attended, people from very different backgrounds, very different geographic regions, very different life circumstances. But, when they spent that time together, first of all, respectfully learning from each other and listening to each other, there was actually so much that they agreed on. And they all came up with recommendations that were consensus based. Each of the five provincial priority panels we did came up with their own recommendations. And then, interestingly, when you looked across all five provincial priority panels, there were so many common themes. So, no matter where in Canada you lived, there was this really a shared sense of values and a shared vision for where people wanted primary care to go. And I think foundational to all of that is that people felt strongly that every person in Canada deserved access to high quality primary care, no matter their background or where it was that they lived.
I love that so much that people were able to find that you found that commonality amongst all the people that had this discussion, because like you're saying, we are being told that we're very polarized right now. So it's
Mm.
wonderful that we can find these through lines where we are identifying how much we actually have in common as Canadians, as diverse as we are, as geographically diverse as we are, and as siloed as sometimes our healthcare systems can be from province to province. We all sort of want that same thing for one another. So that is very good to know. Are you a caregiver feeling overwhelmed, isolated, or in need of support? The SCALE program from the Ontario Caregiver Organization is here to help. SCALE, also known as Supporting Caregiver Awareness, Learning, and Empowerment, is a free program designed for caregivers like you. With one-on-one coaching, group counseling sessions, and practical tools, you can find a balance between your caregiving responsibilities and personal needs. Maintaining your mental health is a crucial step in the caregiver journey. Join us as we unpack difficult emotional experiences related to caregiving and provide meaningful strategies to enhance your mental wellness. Visit ontariocaregiver.ca/scale to learn more. Now, back to our episode. Dr. Kiran, you're very busy. In addition to your practice, in addition to OurCare, in addition to all the other work that you do, you are also the host of a podcast called Primary Focus, which highlights solutions and innovations. Is there for you a particular story that stands out in terms of a conversation you've had on the podcast, or one that conveys perhaps how we can do things differently?
Well, over the last year, I've been really lucky to visit some countries where actually they've made it happen that every person really does have access to primary care. So, one of my recent visits was actually to the Netherlands back in December. And I spent about 9 or 10 days there. And I went to three different cities and visited a couple of different practices, talked to lots and lots of different family doctors, and really learned about their system and how is it that they make it work that everybody in the Netherlands, for the most part, has access to primary care, and primary care not just during the day, but also really a fantastic, interesting after-hour system that makes it very accessible and patient-centered. And I think one thing that I will take away, will share for this audience specifically from my trip to the Netherlands is I think how people who live at home and aren't able to come to the clinic are not forgotten, how they are actually still cared for within the system. And so, in the Netherlands, yes, a different country geographically, we can talk about that, but in the Netherlands, um, pretty much all family doctors do home visits. Home visits are a routine part of practice. In fact, the two practices I visited, every day there was an hour blocked off for every doctor except one to go do home visits. One of the doctors would stay in the clinic to just cover if any urgent issues arose. And there is actually a requirement that patients live within a 15-minute drive of their family doctor.
Imagine.
So that's what kind of makes that possible. And every family doctor has like their doctor bag, and it has, you know, equipment to measure blood pressure and whatnot, but it actually has all sorts of medications, and supporting end-of-life care at home is a routine part of a family doctor's responsibility and practice. And it was beautiful to see, like it's part of a family doctor's identity. And you can imagine for patients how important and special that is, that someone who knows them and knows the family is providing that service to them at home where they need it. And then, interestingly, so in the Netherlands, family doctors are required to be accessible to patients 24/7. And how that's operationalized is generally they have office hours, let's say from 8 to 4, 9 to 5, but then from 5 p.m. to 8 a.m., they generally have a shared after hours services where, often it's actually hundreds of family doctors in a region are collaborating together to serve, for example, 200,000 or 400,000 patients in a region. But these are really sophisticated after hours centers where, people call in with their concern, and based on their concern, they might be told, okay, you can wait to see your family doctor the next day. You can come in to see a doctor right now. That would be appropriate. Or actually, we have a family doctor who can come to your house and to see you. And all of these after hour centers actually have a car and driver that drive family doctors to patients' homes if the patient is not able to come in to see the family doctor and doesn't need to go, by ambulance to the emerge for an acute reason. And so to me, that really just illustrates how primary care in that country and in some of the other countries I visited has been designed also around some of the needs of our most vulnerable who need care the most, who unfortunately in the Canadian context are actually really left behind, and forced to go into, to make choices that are really suboptimal, like going to a walk-in clinic or an emergency department and, potentially waiting on a stretcher for hours on end, when really, what would be best for them is to actually have someone who knows them come to their home and to assess them. So that's one we're going to be doing a little deep dive into after hours in our podcast episodes. So stay tuned for that.
I look forward to that episode and to the podcast itself. It sounds like a very, very necessary one in terms of the conversations that you'll be having. What is it that keeps you hopeful for the future of primary care in Canada?
I think it's the people in Canada. I mean, I think going back to what we found in OurCare was this, really unifying consensus that people care about not just their own situation, but the situation of their neighbors, of the people in their community, their family and friends, of course. They want everybody to have access to primary care. And this idea that we care for one another and want a system that works for all of us, I think is what is really special and what gives me hope. I mean, I think it was really interesting recently, I think it was in January, that there was like, a lot of news media covering a really long lineup in a snow blizzard in Walkerton when people were, there because they wanted to get a spot, a coveted spot when a new family doctor was opening up a practice. So, this was basically people started lining up at 2 a.m. in the middle of a snowstorm because a new family doctor was going to be opening their practice and they didn't want to miss out. And uh, and the stories I think were really interesting because it wasn't like they were trying to just like be aggressive and compete with the person next to them. In fact, they were very respectful with each other and supportive. And when they were in the line, they were actually thinking about, well, I feel badly that there are other people who can't be here, or let me hold place for this person, who has to wait in their car because they have mobility issues. So again, like even in this context of people not having the service they need, we're still thinking about the other. And I think that's what gives me hope.
We've touched on both your podcast, Primary Focus, and about OurCare, the website. Can you just, for our listeners that will very much want to know more about both, can you give us a little bit more information?
Yeah, so just go to our website for OurCare, ourcare.ca. And for primary focus, wherever you get your podcast, you can just search my name, Dr. Tara Kiran, or primary focus, and it should come up. I actually also will have a linked newsletter with primary focus. And if you go to primaryfocus.ca, you'll be able to subscribe to that as well.
Thank you, Dr. Karen. It's been an absolute pleasure talking to you, and we thank you for being on Time to Talk.
Thanks for having me.
Thank you for listening. We hope you enjoyed this episode. You can access more details about support services on our website, ontariocaregiver.ca. Until next time, I'm Michelle Jobin, and you have been listening to Time to Talk, a podcast for caregivers. We hope you have a wonderful day.